My name is Lyn Patrick, and I'm going to be speaking about chronic hepatitis C and nutrient supplementation. I want to start with antioxidants. Antioxidants are really important in chronic hepatitis C. Studies looking at actual blood levels of antioxidants in patients with chronic hepatitis C have found significant deficiencies in multiple antioxidants. And as this slide shows, those in the study, where they actually looked at blood levels of a variety of different antioxidants, who had the most significantly elevated ALT levels, over 100, which we see a lot in chronic hep C, had the most significant vitamin E deficiencies. And we don't think about vitamin E deficiency very much in Western culture. Now we think about it more as a third world vitamin deficiency, but it is a common deficiency in those with chronic hepatitis C. And those who are genotype 1b, which is the most common genotype in the United States and in North America, had significantly depressed glutathione levels when they were compared with those who had other genotype infections like 2 and 3. Genotype 1b is probably the hardest genotype to treat. In other words, it is less likely to respond to standard treatment than genotype 2 or genotype 3 or genotype 1a. We know that glutathione is probably the most abundant antioxidant in all mammals. So all mammals make glutathione as an important antioxidant in not only dealing with chronic infection, but in dealing with environmental exposures like toxins. So we know that those who have chronic viral infections, particularly HIV and chronic hep C, are more likely to have low glutathione levels. And so co-infected patients, those who have both HIV and chronic hep C, are more likely to be deficient in glutathione than those who don't have either HIV or chronic hep C, or who have either HIV or chronic hep C. So having them both is definitely an increased risk for having low glutathione. What does glutathione really do? Well, it's an antioxidant, so it acts as a major antioxidant. It particularly protects against oxidant damage from iron. Iron-related liver damage is a very insidious process in chronic hepatitis C. And so very often providers will check for blood iron levels, serum ferritin and serum iron, as well as look in a liver biopsy to see if there's evidence of iron-induced damage. So glutathione deficiency will accelerate that process. Glutathione deficiency is a very important problem in those with alcoholic hepatitis as well. So, those who have hepatitis C may or may not have a history of alcohol use. If they do, they are more at risk for having low glutathione levels. Why are antioxidants important in hepatitis C? Well, we found, and this is a very interesting study that found that when you give antioxidants, and this was not a human study, unfortunately, this was an animal study, but when you give antioxidants to an animal that has fatty liver, you can down-regulate these are indicators, messenger RNA and collagen-1 and TNF-alpha and cytochrome P2E1 are just indicators of fibrosis. So the important thing here is to know that it's just not a deficiency of antioxidants that's the problem, but that problem can be reversed by actually giving antioxidants. So giving antioxidants actually has an effect on fatty liver and decreases risk for fibrosis from fatty liver, at least in animal models. So what's important to know about glutathione is that it's used up in the body. The reduced form of glutathione is used to quench or grab onto oxidants or free radicals, and it then becomes oxidized. It kind of sacrifices itself. In the process of trying to get glutathione back into a usable state, what our bodies do is use vitamin E, vitamin C, alpha-lipoic acid you've probably heard of. It's an antioxidant vitamin that we actually make, selenium, which is a mineral, and coenzyme Q, which is a vitamin, to help recycle this glutathione so that it can go from the oxidized form to the reduced form. And then it can continue to be active in the body and act as an antioxidant to help be a detoxification protein and an immune stimulator. So glutathione has a very important role to play in chronic hepatitis C because it not only helps the immune system directly address the viral infection, it also helps the liver detoxify a variety of things that the liver is exposed to. And that detoxification capacity is decreased in patients with chronic hepatitis C. Now, silymarin, which I'm going to talk a lot about during our sessions, has a role to play in chronic hep C. We're actually starting to define that role. But one of the things we know about silymarin is that it does raise hepatic glutathione levels. Actually, silymarin acts as a very potent antioxidant. It has many roles to play as a botanical, but in the liver, it acts directly as an antioxidant in liver tissue. And in chronic hepatitis C, as we'll see later on, it's now being used intravenously to increase the chance of responding to standard treatment. So silymarin is actually a very important botanical, even though in the oral form it has not been shown to lower levels of active hepatitis C viral loads. We probably cannot raise blood levels high enough to do that with an oral form of silymarin, but the intravenous form has been shown to have a very potent effect on the immune system. That doesn't mean that silymarin is useless in chronic hepatitis C. That just means that we have to know how it acts orally and how it acts intravenously and what the difference is.